So what are embrasures? Embrasure is basically this area right here. So this is called type 1 embrasure, and that's because if you look at the papilla is this area right here in between the teeth. If you look at this papilla, it is completely covering this space over here, and so that's known as type 1 embrasure. And so what would you use to clean the interproximal area over here? What would you use to clean in here? And it would be a floss. So a dental floss is the ideal interdental aid to use when you have type 1 embrasure space. If you look at type 2 embrasure, look at how the papilla has been reduced, almost halfway, right? So again, type 1 embrasure, the papilla is intact, it's completely full. The embrasure space is completely full by that papilla, but in type 2 embrasure, you can see the height of the interdental papilla has been reduced. Now let's think about what you can use over here. If you want to clean the area over here, what could you use? Well, floss won't be as effective. What would be more effective would be either a stimulant, such as a wooden toothpick, or an interdental brush. Now, when you're choosing interdental brushes, it's really, really important that you use the right type of brush for the embrasure space. Let's say I was to use this. So if I was to use this interdental brush, but very big bristles and a big brush, would that work in this area? No, it won't, because if I were to use this and push on this area, what I would do was further traumatize the gum. I would create a bigger gap. I would create a bigger hole. So it's very important that you assess the space over here, and then based on the space, find a brush head that would fit in there easily without traumatizing the gums. So type 2 embrasure space, interdental brushes with the appropriate head size, and a wooden toothpick such as a stimulant would be effective. So now we know type 1 embrasure, full papilla. Type 2 embrasure, half papilla. Type 3 embrasure, no papilla. Look at that. There is absolutely no papilla. It's like blunted. There's a complete space here. And when you have a type 3 embrasure space, when you have that huge gap over here where there's no papilla, the effective interdental aid would be interdental brushes. So these type of brushes, but perhaps one with a bigger brush head size that will fit in there nicely. So floss is not effective, but an interdental brush with a bigger bristle is effective, and an end tuft brush is also good. So we know end tuft brushes are very good for like the last molars of your teeth, to clean like the very last distal of that last molar, but it's also good for embrasure space as well, so it can actually get in there nicely and clean in that area. Floss won't be as effective because it won't disrupt any food particles or any plaque or debris there. It won't be as effective, but an end tuft brush or a bigger interdental brush would be more effective. Now let's look at root concavities. So what is a root concavity? A root concavity is basically a depression in the root. So let's look at this. Let me see if I can find a better picture, but actually let's look at this. So right over here, there is a root concavity. There is a depression. And if I were to use floss, okay, let's just say if I were to floss in this area, what would happen is the floss would, take out everything on the lingual and the facial side, but the very inside that depression, the concavity, nothing is removed. So what we need to do is we need to use an interdental brush. So here's another example where floss may not be as effective. Sometimes we need to use other tools like an interdental brush. And when you use an interdental brush, it actually gets right in that depression. This is the depression right here. This is the concavity, and it cleans everything out. So you can see it from a different angle. Using the floss, we'll remove a plaque from this side and this side, but not from the concavity. But when you use an interdental brush, you can actually get into that concavity area, and it can effectively remove the debris from there. So we might always want to be tempted to, recommend floss to our clients, but we have to look at the embrasure spaces. We have to look at whether there are concavities exposed. So sometimes people have recession, and the gum line might be up to over here, and so then there is the concavity that's exposed. So we want to recommend an interdental brush for those areas. So here's a summary just telling you that if someone has a type 1 embrasure space where the papilla is full, the floss is the best thing to use. If someone has type 2 embrasure where the papilla is reduced halfway, then you want to use an interdental brush with the appropriate head size and a wooden toothpick like a stimulant. And then if someone has type 3 embrasure where the papilla is gone completely, interdental brushes, again with the appropriate head size, and end-tip brushes are appropriate.